Okay, so let's kind of do an overview of some of the 206 bones. Looking at your worksheet, the first bone that's on there is the frontal bone. So commonly we would say that's the forehead. And that is part of the cranial bones which make up the skull. This is the upper jaw, but it is also known as the maxillary bone or the maxilla. So for maxillae, you could put upper jaw. The lower jaw, which happens to be the only movable facial bone, is the mandible. So the mandible is the lower jaw. Here we have what we normally refer to as the sternum. We might say that it is the breastbone. So the location, you could put breastbone. Now let's look at some of the vertebrae. We know that there are 5 basic types of vertebrae. The first 7 are called cervical vertebrae. So on your sheet, you might put neck backbone. The next 12 are thoracic vertebrae. So you might put chest backbones. The 5 vertebrae that are found in the small of the back, remember small of the back is lumbar, so these very sturdy ones are the lumbar vertebrae. You might put small of the back vertebrae. And then we have a sacrum or a sacral vertebra. It actually was 5 vertebrae that fused together. So there's 1 sacral vertebra. And then there's 1 coccygeal or coccyx vertebra as well. It was 3 or 5, but they fuse together when they completely ossify. A good way to remember the number of vertebrae is that you eat breakfast at 7, you eat lunch at 12, and you eat dinner or supper at 5. So 7, 12, and 5. And then there's 1 of the sacral and the coccygeal. So let's now move back to the front of our skeleton. We're doing the axial system, and so we're going to look at the rib cage next. We've already looked at the skull and the vertebral column, so the only other part of the axial system is the bony thorax. And so let's look at the ribs. You have 1, 2, 3, 4, 5, 6, 7 ribs that are attached to the vertebrae in the back, and they're attached to the sternum in the front, so they're called vertebral sternal ribs or true ribs. So on true ribs, you could put rib pairs 1 through 7. The next 3, which would be 8, 9, and 10, are actually attached to this cartilage and then go into the sternum. So since they're attached to the vertebrae in back, we say vertebral, but they're attached to cartilage in the front, chondra, so the vertebral chondral ribs or false ribs. So you could say 8, 9, and 10 don't attach to the sternum directly, are the false ribs. And then if you notice, there are 2 pair of ribs. Here's 1, and here's another that doesn't attach to the sternum at all, and so we refer to those as floating ribs. So 11 and 12 are floating ribs. We have 12 pair of ribs. The next bones on your paper are ossicles. Ossicles are your ear bones. And they include the hammer, the anvil, and the stirrup. This is a model of the ear, and you can see that this is the tympanic membrane, and attached to it is the hammer, attached to it is the anvil, and attached to this oval window is the stirrup. Now really the technical names are the malleus, the incus, and the stapes. And these bones are about the size, well, they're smaller than a dime. So you can see that they're very small bones And what happens is when sound hits the tympanic membrane, it causes the bones to vibrate, which causes fluid inside of this structure to vibrate. There are hairs inside that structure. They also vibrate, and it turns that mechanical message into an electrochemical message that then is sent down the auditory nerve to the brain and interpreted as sound. So those are the ossicles. Another bone that's kind of unique is the hyoid bone. We find the hyoid bone. See, I'm kind of turning this abnormal. You can see that the hyoid bone is right there. It's actually attached to the tongue. It sits on top of the voice box, or the larynx. It is the only bone that does not articulate with any other bone in the body. So it's very unique, this U-shaped hyoid bone. So you might on your worksheet put does not articulate or join with any other bone in the body attached to the tongue. So now let's move on to the appendicular system. We're going to start with the pectoral girdle, which would be the girdle at the top. It's made up of the scapula, which is the shoulder blade, so you can put shoulder blade for scapula, and the collarbone, which is the clavicle. So clavicle, you can put collarbone. This makes up the pectoral girdle. The appendage attached to the pectoral girdle then is the upper limb. You can see, back up, in the skeleton, that the upper arm bone is called the humerus. You know, sometimes we hit our elbow kind of in a particular place and it stimulates a nerve and we say we've hit our funny bone. Well, this is really a funny bone. It's the humerus. The lower bones are the radius and the ulna. Now, how are you going to tell the difference between the radius and the ulna? The radius is always going to be attached to the thumb, and the ulna is going to make up the elbow joint. So the one that has the notch is the ulna. The one with the flat head and that attaches to the thumb is the radius. So if I were to put my skeleton down in anatomical position, lateral would be the radius, medial would be the ulna. But if my skeleton is not in anatomical position, because that radius can rotate, if I pull it around, you see how the radius can radiate medially to the medial surface? And so it's very, very important to always know that the radius follows the thumb. These are the wrist bones, and you will learn the names of the wrist bones later. They're carpals. These are metacarpals, and these are phalanges. The phalanges are your fingers and your toes. The metacarpals are the palm of your hand. The carpals are your wrist. Now, how many phalanges do we have? We have 1, 2, 3. So that would be distal, intermediate, and proximal phalanx. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, and the thumb only has 2, 13, 14. So we have 14 phalanges on each hand and actually on each foot. So let's go down to the pelvic girdle and the lower appendages. This is the pelvic girdle. This big fan part of the os coxa or coxal bones, so coxal bones are the hips, is actually called the ilium. This front part is the pubis, and back here where you sit, that's the ischium. So ilium, ischium, and pubis. And those are fused together and make up the coxal bones or the os coxa. And so now we're looking at the lower limb bones. And this is the strongest, largest bone in the body. It is the femur, the thigh bone. Resting on the thigh bone is the kneecap, which is the patella. Although it rests on top of the femur, it attaches actually by a ligament to the tibia. So it's going to attach by a ligament right here to this tuberosity on the tibia. So when we look at the lower leg bones, we have a big one, the tibia, and a little one, which is the fibula. And I always like to say it like tibia and fibula, because if you tell a little lie, it's a fib, and the law tells you it's lateral. So the fibula is the little one that's lateral, and the tibia is the bigger one that's your shin. The ankle bones are tarsals, and you will learn those later. These are metatarsals that make up the sole, and then of course phalanges. So tarsals are ankles, metatarsals are the sole of your foot, and then the phalanges again are your toes. So that is a quick overview of all of the bones of the body. And on your second bone pre-lab, you will actually color code and label a skeleton using the names that we've just gone over.